Hello, my name is Chip and I'm a paramedic instructor for the state of North Carolina. And today we're going to talk about first aid treatment for a severed finger. If you have to respond to someone or you yourself, you lose a finger in some kind of an accident, a couple things you need to take note of. Number one, we need to try to recover the finger. So for demonstrative purposes, this will be our finger. Let's just assume for a second that my finger is cut off. Obviously, the first priority is to stop the bleeding. So we want to take and apply some kind of gauze or bandage directly to the site, slow the bleeding down as best as possible. Typically with a finger that is severed like that, there won't be a whole lot of bleeding. Oftentimes the blood vessels will spasm and close up, so you don't get a whole lot of bleeding. One thing you need to take note of, though, if you happen to see the bone, it's important you don't rub the bone in because that can cause problems later on for the surgeon. So again, just steady direct pressure, tape that down securely. If bleeding starts to go through there, just apply more gauze and again tape it down again. Elevate it, that'll help with the bleeding control as well. And obviously have the patient sit down or lie down so that they're not getting too dizzy and unstable on their feet. Now for the finger. Of course we have gloves on during this whole ordeal. With the finger we never want to touch the end that's been cut. We do, however, want to clean it. We can take some bottled water or tap water, gently rinse over it. Once we do that, we want to take and wrap the finger, sterile gauze or anything clean. Simply want to wrap it up gently. We want to have a bag of ice. That can be a cold pack of regular ice, but we never want to put the finger directly on the ice because that'll cause damage and it could definitely affect the way it can be reattached later. So we take the ice, put it in another bag, put the finger again that's wrapped in that same bag on the ice. Again, it's not touching the ice, it's got the gauze in between. Zip that up. And then we have a nice package to give to the folks on the ambulance, the EMTs and paramedics, or if you're at a hospital as far as very close to it and you don't wait, you can go and just make sure you bring this with you. Once you do, tell them if you can about what time the finger was cut off and that you have a finger in there, so they will put you as a priority because there are some time limitations on reattaching that finger. We want to go back to the patient to make sure the bleeding is stopped, definitely. And if not, again, keep applying that bandage, more gauze, try to give firm pressure, and again, make sure you call 911 if the bleeding is not controlled. And that's how to treat a severed finger.